All right, folks, perfect. Shelby, if it's all right, we'll start with you and we'll let you go and tell us all about Brightpoint. And for those of you who don't know me, I'm Kevin McNicholas, school social worker here in Gillespie. And my honor to run mental health first responders, and we will turn it over. Shelby, I will make you a co-host, so you should have rights to share if you've got a presentation or anything, and I'll
Okay.
keep an eye on the waiting room so you won't have to worry about that. Thank you.
Perfect. Thank you. Thank you so much for the introduction. I'm so happy to be here. Like Kevin said, my name is Shelby. I am with the ASAP program, or Adoption Support and Preservation Program, with Brightpoint. Brightpoint used to be called Children's Home and Aid, or Chassis. So if you're familiar with them, we are now called Brightpoint. So ASAP is a community-based therapy service for children or for adoptive families. So we're very community-based. We are in homes, we are in schools, we have offices throughout Madison and St. Clair County. We are very flexible in where we're willing to meet, really there to meet the needs of families. So we accept families of any kind who have adopted or subsidized guardianship of their children. So this could be a DCFS adoption through foster care. It could be kinship, non-kinship. It can be private. You can even be an international adoption. The only requirement is that they've been adopted or subsidized guardianship. Our services are completely free. It does not matter insurance. It does not matter income. We don't actually even bill insurance, so we're very accessible in that way. We accept children's ages 2 to 18 typically. We do make an exception for children above the age of 18 who are still receiving that subsidized guardianship, maybe due to some sort of developmental disability. So if the parents are still receiving a subsidy for a child over the age of 18, then we can still provide services to them. We provide services in a huge service area. I am going to send something in the chat. Let me get that pulled up here. So I'm going to send a few different things here. So I'm going to send our ASAP flyer. This has all of our basic information on it. I'm going to send, let me find it here. This is the state map. So if you are in one of the more northern counties, we may not reach all the way up there. So this will show you who your ASAP provider is in your area if it is not Brightpoint. And then I've got one more that I'm going to share in here if I can find it. I might have to come back to that one for just a second. Yeah, so if we do not reach your area, you can take a look at those maps and figure out which service provider serves your area. But we serve like 37 different counties, so we have a pretty big service area. So services last anywhere from like 6 months to 2 years. There's kind of two different routes that you can take as far as getting involved in ASAP. One is the START program. START stands for Start Early, Trauma Informed, Attachment Focused, Resiliency Building Therapeutic Services. So this is really more for families who are wanting to be preventative or proactive in receiving services. Maybe things haven't reached quite a crisis level. Maybe they don't need super intensive therapy, but they are maybe, struggling to have some of the tough conversations that come along with adoption, or maybe they're dealing with some more mild behaviors and they just want someone to get in there and provide some preventative services, which is awesome. We love that. The earlier, the better. But we do have a more intensive program, kind of our more traditional route. That starts at about 1 year. And then at the 1 year mark, if they need an extension, we can extend it out to 2 years. 2 years is the max. After 2 years, they have to take a 6-month break before getting put back in services. So if they start at age 2 and they receive services for 2 years, take a 6-month break, another 2 years, 6-month break, there's no particular limit on the number of times they can be enrolled in our services. There just has to be that 6-month break in between so they can practice using those skills in a more independent way. So those are kind of the two routes. And if somebody does enroll in the START program, when we get in there and realize, oh, maybe they need more intensive long-term services, absolutely fine, super easy transition. Our services include assessment, providing a plan of service, and then we do individual and family therapy. Like I said, we can do schools, homes, offices, community-based stuff. We also do a lot of case management, so providing referrals, and things like that. And then a lot of support and advocacy. So attending IEP meetings, collaborating with psychiatrists, DCFS workers, intact workers, you name it, we like to be in regular contact with them so that we can really wrap around the family and provide them with a lot of support. Our therapists are trained in many, many, many different modalities. So we've got TBRI, which really focuses on adoption and foster children specifically. Very attachment based, really focuses on the complex needs of children who've experienced like adversity and high levels of stress in early childhood. Lots of stuff about neurobiological responses to trauma, sensory input, nutrition needs, and things like that. We're also trained in ARC, which stands for Attachment Regulation and Competency. Very attachment focused. We love attachment and trauma informed services over here in ASAP. Lots of regulation skills with ARC, and then of course voice and choice and empowerment, things like that when it comes to parenting and child decision making. We also provide Core Teen, which is a training program for those parenting older youth with moderate to severe emotional behavioral challenges. We're also trained in TheraPlay, which very much focuses on parent-child relationships. And again, building attachment, all about attachment. And then lastly, here we are trained in NTI, which is provided by the Center for Adoption Support Education. It is web-based, but it provides so much knowledge about different modalities, different needs, different types of grief that children experience. I mean, it's just a really, really thorough and fantastic training that we go through. And then that is by no means an exhaustive list. We have therapists who are trained in lots of different things, trauma-focused CBT. We've got a few who are in EMDR training next week, which is super awesome. I'm really excited that we'll have some folks who can provide that service. And I'm getting towards the end here. We've got a couple more things. We also have a respite program, which is super cool. So what respite looks like for us is that we will have a worker that will come out to the home and take the child out of the home for a few hours at a time. And usually that includes like going to do fun things. Like I've got a kid on my caseload right now who gets respite and he goes to Sky Zone a lot. So to jump on trampolines and just get all that energy out and have lots of fun. It's super awesome for kids who might need some extra help in the social skills department because they just get to go out and they get to experience that with like a safe person to help guide them through those challenging interactions. It's super awesome. I love our respite program. And it's not overnight or anything like that. It's just for a few hours so the kid can get out, have some fun, parents can decompress and have some time to themselves, but it's a great program. And then last but not least, we have a therapist who is on call 24/7 for those crisis situations. So it may not be the therapist that's particularly assigned to your case, but you will have somebody who is there on call along with the supervisor. If something happens after hours and you really need some immediate assistance, we are really great with helping out with navigating, making like SAS or CARES line phone calls if maybe a parent's never done that before, helping them with that process or helping them determine if we need to take further steps, like just driving them straight to a hospital. And maybe that's not necessary. Maybe our therapist can just help decompress, can help with kind of mediating and helping get us out of a crisis state. So that's a really great option that we have as well for those families who may be dealing with the crisis. That is about all I have for you guys today. I'm going to send you a couple more things. I'm going to send you a link to the Path Beyond Adoption website. Let's see if it'll paste here. So this is where you can get tons of information about ASAP, just kind of in some more detail. So if Brightpoint is not your service provider, it has a list of all the service providers. You just click on which one and it'll take you straight to that service provider's ASAP program and you can get direct information from there. And if you're not sure who your service provider is, there's actually a Path to Adoption kind of phone number that you can call and they can point you in the right direction. So that's super helpful. Just lots of good resources on there. And I'm going to see if I can find that other map that I wasn't able to find earlier to send to you guys of just what Brightpoint, the services that Brightpoint provides to what counties we go out to. So thank you all so much for being here. I'm absolutely open to questions. If you have any, just shout them out or send them in the chat and I will do my best to get those answered. And Kevin, again, thank you for having me.
Shelby, thank you for being here. And when I go home and tell our 12, 10, and 8-year-old that you were talking about Sky Zone, they're going to immediately want a trip. That is fantastic because I think, I mean, not only all the services in terms of therapy and all of that, but the respite piece of it has got to be just a godsend on both ends. That's very mutually beneficial to both the children and to the parents. And I think that would definitely head off probably a lot of issues, or at least moderate them, to be able
Oh,
to take that
absolutely.
break and recognizing that's a great coping strategy. Just take that break, have a
Yep.
little bit of that separation, and that's excellent.
Yes, absolutely.
Anybody questions or input for Shelby? I've got the website and I took some quick notes.
Mhm.
And if you've got anything else that you want me to send out, I'll just send it out in the form of an email with the meeting recording and stuff.
Sure.
And also, I've downloaded the PDF that you put on there earlier, so we'll send that out as well. But anything else you want me
Perfect.
to include, 100%, we'll get that sent out. So
No, I will send my email and my supervisor's email in the chat. And if I think of any other helpful things, I'm sure I'll think of something throughout the meeting. I will just go ahead and send that in the chat as well.
perfect,
Great.
perfect,
Thank
perfect.
you.
Much appreciated, Shelby. Anybody else got anything for Shelby? Awesome. Thank you so much. Appreciate
Mhm.
you. Terrence, we will give you the floor then. Shelby, sorry, I can only have one co-host, I think that's all. So I'm gonna borrow that back from you. And Terrence, I'm going to give you co-hosting rights. And if you need to screen share or anything like that, Terence Major from Cartwheel, this is a new partnership for us here in Gillespie as well. And he very kindly agreed. What did we meet yesterday? I was going to say
Yeah,
on
yesterday.
literally a moment's notice. So I appreciate you being here with us, Terrence, and we'll switch over to you.
All right, no worries. I appreciate the time, and yes, I'm extremely happy to be here today to share with you guys the work that we're doing here at Cartwheel. Very impactful, and so excited. If you have questions at the end, definitely feel free to reach out. I'll have a QR at the end too, where you can book a meeting directly with me. But let me share my screen here really quick. I'll run you guys through a pretty quick presentation. Hopefully, I don't bore you too much, but I think it's going to paint a really good picture of Cartwheel and who we are. And so I think I'll just start it here. As you guys know, we are Cartwheel, but our mission to be a trusted mental health partner to school students and families stems from our foundation, and I think that's very important. Our founding clinical team worked within schools and community-based organizations, and they understand the challenges that you're currently facing. We were founded after the pandemic. We saw the rising need in mental health needs and gaps like wait lists, accessibility barriers, and limited collaboration, but then also sustainability as a lot of these ESSER funds began to dry up, right? And a lot of funding went away. And these were struggles that a lot of our existing partners were currently dealing with. And so Cartwheel was built to fill these gaps and deliver more of a school-centered care that we believe districts deserve, all right? And so as we set out to tackle this problem, our founding team came together around one vision, and that was to create a standard for mental health care, a new standard more so for mental health care in schools. And at the heart of that vision is the belief that every student does deserve access to high quality mental health support. And this commitment is anchored by these 5 key principles that we have here, and that's without a wait list, right? Care should begin immediately, not within weeks or months. All students, regardless of insurance, should have access to these supports. Services are scheduled to fit within the students' and families' needs and schedules. And then care is delivered in that student's preferred language. We've seen a lot of language barriers. And then the most important is that all of our care aligns with proven research to maximize impact, which is very important for us, but then also the communities that we serve. So it's these principles that guide everything that we do here at Cartwheel, whether it's onboarding new district partners, designing a care plan, or even building new services. Our focus is always on making mental health care accessible, inclusive, and effective for everyone involved. So on this next slide here, I have a map to kind of highlight our growth, let's say over this last year and a half across the state of Illinois. For me, which is amazing because I'm from Illinois, grew up in Chicago, but we are now in 40 districts as of December 2024 across the great state of Illinois. And we're growing that to 60 plus by this coming summer of 2025. We're providing support, and we have over 100,000 students enrolled within Cartwheel across the state of Illinois, and we currently employ over 150 plus licensed clinicians on the Cartwheel team that are available to support students via telehealth, and they're also Medicaid approved as well. So that's to give you more of an idea of, kind of where we are, our footprint here in Illinois. And then as we begin to grow these partnerships, there are some common themes that really stood out from the partners as we bought them on and we onboarded them. And one of the number ones was there's a rise in just the mental health needs, right, across the state. Accessibility, accessibility and access, right? This is a common theme as well, right? There's waitlist delays to access to urgent care. Regardless of community partners, they deal with high turnover as well. And that's been a struggle. There are language barriers limiting access, especially in diverse areas like Metro East. Insurance gaps leaving some students without options. There are Medicaid, or let's say your community partners that only accept Medicaid. They're not accepting students with private or commercial insurance. And that's been a problem for a lot of our partners, especially when they have students who have private or commercial insurance. And then practical issues like scheduling, transportation, making it harder for families. And then there's this parental responsibility. So when the schools share the resources, families often face challenges following through, leading to inconsistent support for the students that are looking to get the support. And then collaboration challenges. This has been really big. Some agencies collaborate well with schools, but others provide limited follow-up and unclear care plans, and more so leave the staff in the dark. So what we saw is that these challenges show a need for a scalable mental health solution that reduces wait times and increases access, and fosters better collaboration for schools, families, and providers alike. And so how does Cartwheel work? How do we tie into kind of helping when it comes to addressing these barriers and gaps? It's really simple. Our work revolves around three unique key components that define how we support districts and deliver impactful results. And it all starts with your Cartwheel team. We are not a referral service. We are an actual Illinois licensed medical practice tailored specifically to meet the mental health needs of your school. So when you refer a student into Cartwheel, they're connected directly into our in-house team of experts. We have nurse practitioners, child psychiatrists, licensed therapists that are all trained in evidence-based approaches like CBT and DBT. 40% are bilingual and bicultural, reflecting the diversity of the communities that we serve. And all of our clinicians hold either a master's or doctoral level license and bring years of experience in either school-based or community-based settings. We also provide dedicated case managers. When every student is assigned into or is referred into Cartwheel, they're assigned a case manager. That case manager contacts that family within 24 to 48 hours to schedule that initial intake. They handle all of the insurance details, answer any questions that the parents may have, and then they more so act as a guide, catering that student, that family through that care journey, through the entire process. All right, so they feel supported, so they feel heard. And honestly, here, I love this note. It's because of our care coordinators in our coordination team that we've achieved a 75% success rate in completing referrals and getting students into care, which is double the national average of 40% that's reported by leading Harvard Medicaid clinics as well. And then lastly, as you see here, the clinical program director, we provide all of our districts with a clinical program director. This is a licensed clinician with 10 to 20 plus years of experience working within schools. They'll act as an extension of your team, attending board meetings, parent education sessions, consulting on cases, and also ensuring that the partnership aligns with the district's goals and MTSS strategies, making them a highly valued resource for our district partners. And so that's one of the first unique components. The second key component of our model is how our team supports our partners. And we do this in two ways, and that's by providing direct clinical services and then delivering comprehensive wraparound supports. So how that kind of works is our clinical model starts with one-to-one evidence-based therapy, and that's designed to help students address their mental health challenges. And then to further personalize the treatment so that we fit the treatment to the child and not the child to the treatment, we provide additional layers of support. And so that's going to be family therapy, right? To engage families to create more holistic solutions, one-on-one parent-parental guidance. And this is to empower families with strategies to support their child's mental health. We have some students who are resistant, right, to therapy. You also have that pre-K to 5 range, right, who probably just, they're not ready for that. And believe it or not, a third of our services is actually one-on-one parent guidance. And so we're really big on that and including the family. We provide psychiatric evaluations and medication management to ensure students with more complex needs receive appropriate care. We have confidential therapy for staff to reduce educator burnout and help promote staff well-being as well. And then we have an intensive outpatient program, and this provides a higher level of care for students while still keeping them connected to their education. And then lastly, accessibility is a cornerstone of our model. So we deliver all of these services without a wait list at all, in 15 plus different languages to ensure that we are accessible for more diverse populations and inclusive of insurance coverage. So families with Medicaid have a $0 out-of-pocket cost. for care with us. And then families with private or commercial insurance will be subject to either their copays or deductible. It's really based on their insurance plan. And then flexible availability. Our services are offered from 8 a.m. to 8 p.m., including evenings, weekends, and then school breaks to ensure that students are able to stay connected to that support. And then the second key component here is going to be the wraparound support services. And we've already kind of discussed two of these folks, right? And that's going to be our care coordinators. But all of our families have that one-on-one bilingual case manager for every family to help shepherd them and guide them through the care. For school supports, it's going to be that clinical program director. And that, again, that person is in place to be more of an extension and to ensure that our districts and our partners feel supported and we're getting the most out of this partnership. We're constantly delivering psychoeducation, providing webinars to the communities and families to allow them to have a better understanding of the students' mental health needs and how to better support. And then the third key component is going to be the visibility and teamwork. So we provide all of our partners with the HIPAA compliant portal. This was professionally designed with the Massachusetts Department of Education. And within this portal, your counselors can now refer students to Cartwheel within 3 to 5 minutes. You can track student progress in real time, collaborate directly with our clinicians as well pertaining to students' needs. And then also view engagement and outcome data, which is extremely important in gauging the effectiveness and impact of our program as well. And then the second thing is updates. We keep you in the loop, right? Whether it's simple needs, needing help reaching out to families to start. The intake was scheduled, right? With the start date, the intake was complete. The student is graduating from care soon, or even urgent situations. We have it a lot where students probably experience a situation and we want to communicate that back to the school district and to the counselor as well. And again, we handle all of the parental consents and onboarding for parents as well and kind of relieve the district from that side of mental health management, all right? And then the final component to Cartwheel is we're built to be sustainable. Again, we were created specifically to support school districts. And so 75% of our program is covered by health insurance, all right? And it's a braided funding model where, again, your families with Medicaid, they have a $0 out-of-pocket cost. And then families in network will either be subject to their copays. And then the school's contribution for the program more so just covers the non-billable components. And that's going to be the wraparound services. So that clinical program director, right? The case managers, ensuring that we reserve capacity so none of the students have a wait list, regardless of whatever the need is. And then we also bake in a financial aid fund for your non-insured and underinsured students as well to ensure that they still have access to the supports that we provide here at Cartwheel. And so I'll kind of wrap it here with this. I'd like to discuss our partnership with Edwardsville District 7. They had challenges that are very, again, similar to a lot of our other partners, where they had partnerships with local districts. And they only saw students that, let's say, were in Medicaid plans. More than half of the families in the district had private insurance plans. A lot of the counselors and social workers with the agencies, they relied on families to engage. This was tough, making sure, hey, if the family reaches out, then we can provide the support. There was zero collaboration between the clinicians and the district partnerships, and there was no true engagement data on the outcomes, right, after referring a student in. And so Cartwheel was more so put in place to kind of provide those supports to ensure that, one, we had consistent service available for students, whatever the need was. We connected directly with the families to motivate and encourage that collaboration between the families and get them onboarded and engaged and into care. And then, of course, providing district with consistent feedback and data, as well as to where that student is in their care process, any outcomes, right? Any current mental health trends going on across the district as well. And of course, in real time, and ensuring that the counselors and the overall district feel supported going through this process. And so in a nutshell, that is Cartwheel. Again, a trusted mental health provider for our school districts and partners, built to kind of help solve these main barriers, right? Of making sure accessibility is no longer an issue, right? Making sure that students can get access to these high quality supports without limitations, but then also relieving districts from the need of mental health management and placing that directly in our hands. So that's all I have for you today. I want to thank you for your time. Again, if you have any questions, you can either scan this QR code, or I'm also going to send over one of our one-pagers to Kevin as well following this presentation to ensure that you are able to get back in contact with me. Thank you, Kevin.
Terrence, thank you very much. And any questions for Terrence from our group today?
I have several questions.
I like questions.
The first is, and I think maybe you answered this, but so it's a combination of you have contracts with school systems and you also get fee for service. That's how you support yourselves. Is that correct?
That is correct.
Okay. Second of all, how do you match up the patients with their clinician? Is it based on, I mean, do you have specialists? For instance, I was talking to a mother yesterday who had problems in our rural areas finding somebody who could treat eating disorders. You know, there's eating disorders, there's kids who have, been, experienced sexual abuse, that kind of thing. And not every clinician is appropriate for those kids. How do you guys match those clinicians up? Is it by problem or expertise or?
No, that is a great question, and thank you for asking. So I didn't dive too much into the portal. Now, when your counselors refer a student into Cartwheel, it takes 3 to 5 minutes. They provide a lot of the information as far as the different needs that the student may have, right? Or maybe situations that student is experiencing. They're able to provide us with that information up front so that when we then provide or connect that student to that clinician, it's a clinician that is experienced in handling those specific type of cases. And so that's how we go about it. A lot of our clinicians, do specialize in multiple different areas of support as well, which is, of course, an added benefit to Cartwheel. But that's how we kind of go about doing that. It's all done from the referral that's put through by the counselor. We then take that information to then better match that student to one of our clinicians.
Okay. And I may have missed this earlier on, but is all of this virtual or is there some kind of in-person component?
Yes, no. So this is 100% teletherapy. We provide all of our services via teletherapy. Our goal isn't to replace any of your internal process or even community partners. Some of our partners utilize us throughout the day on school site, but honestly, we're more so put in place even to extend that service, right? To ensure that, again, if a student, maybe they have a more extreme case, you don't want to open up a can of worms midday. So maybe after school work better for that student will be available, right? In the comfort of their own home. For example, my daughter, she does her therapy sessions from the comfort of her bedroom.
Yeah. So, I work for a inpatient mental health hospital just for kids. And part of our problem when we do some of like our intensive outpatient programming and stuff like that is, the kids have to be out of school. So I like hearing that they could do stuff, and still attend school and still get that help. Yeah, that's great. It's good to hear. Are you just partnered with schools or do you have other partnerships?
So we are just partnered with schools, but we are exploring, of course, other opportunities as well.
Okay, that's great. Thank you.
Thank you.
And Chaz, honestly, I can't walk around inside your head right now, but knowing probably where you're going with this, if I had a student I referred to you and then we had a hard time with the follow-up, you could definitely refer somebody through the school and we're partnered with Cartwheel. That would probably be, I mean, very advantageous to us, really. Be another layer.
I'm personally considering like the problems we have at discharge with oftentimes securing those appointments for not school counseling necessarily, but for any kind of mental health treatment that these kids need. There aren't a lot of options sometimes, and so so get out of my head. I don't care for it.
Apologies, it was just brief. But honestly, I mean, that reminds me though of kind of what we were doing with our Zoom appointments and Teams appointments and stuff during COVID, because I feel like I get a pretty good picture of a student's functioning here at school. But when we were on these things, and I mean, kids were, exactly to your point, Terrence, doing their appointments from their rooms or from their living room. And then I had a view of what their living environment looked like. And I could hear, things that were going on in the background and all that. So I think that kind of informs, that would inform a therapist in kind of another layer of that therapeutic relationship too.
Yeah.
Cool. All right. Ladies and gentlemen, any other questions for Terrence while we are here? Hearing none, Shelby and Terrence, thank you both so much. I've got all of your info. I'm going to send that out along with the link to my YouTube channel. We'll have the meeting put up on there. And again, we'll have Terrence and Shelby's contact info for further questions and follow up and all of that. Two fantastic presenters from two fantastic organizations, and looking forward to our continued partnerships with both of you and with Cartwheel and with Brightpoint as well.
Thank you, Kevin.
Fabulous. Thank you very much.
All right, team.
Friends, anything else for the good of the group today?
Me again.
Yes, welcome back.
Hey, yes, Chaz again. I would like to thank the Mental Health First Responders Network for all the donations for the kids over the holidays. I'm working on getting some sort of more concrete answers on what we did with it. Obviously, because of HIPAA standards, we can't take a lot of photos or share a lot of things, but I'm trying to get some of that information so you guys can know exactly, how it went and what the reception was and everything. But I do know that, those kids that are with us over the holidays, especially those kids who have, maybe youth in care or something like that, that have stuck with us for months at a time, that outside participation from you guys is amazingly helpful. So thank you very much. I appreciate it.
Chaz, I think I speak for everyone when I say that spending the holidays in inpatient care is definitely no one's idea of a great time. But if we were, as a network, able to bring some smiles to some faces, and also to ease up the burden on your staff, who I know has generously funded this for a long time now, I was thrilled. It came together beautifully, and again, through our partnerships here, through the network, that was a tremendous blessing for everybody involved. So fabulous, and thanks to everybody who contributed as well. That was phenomenal. And Chaz, we get to hear from you next month on the 20th at the same 11 o'clock time. Chaz, I just texted my wife during this meeting today. This 11 o'clock time has been a godsend with our internet here. It's been bogging down so much less, and that was your idea. So again, for the good of the group, thanks for throwing that our way. And we'll look forward to your presentation. I've got you down next month for the LGBTQ teen community and mental health, which I've heard this presentation from you a couple of times before, and I know it's phenomenal.
Okay. Yeah, I'd forgotten that, so I'll make sure I'm up to date.
Surprise.
Always willing. I can
Sure.
do it usually within a day's notice. So
That's, well, much appreciated. Yeah, I would have sent out that email on, February 15th, and you would have said, oh, shoot, yeah, well, we'll see you guys next week. But so, yeah, we appreciate you, and I appreciate everybody being here with us today. I do not have the CPDU form, but I will send that out in the email for folks who need the CPDU's continuing ed hours. So long as there's nothing else, we will sign off for today. I appreciate everyone, and thanks so much again. See you next time. Appreciate you, everybody. Thank you.